I certainly would like each and every one of the patients that comes to me to know that I as an individual and we as a group based here at the Baptist Hospital are their number one advocates. Like I said, and our group want them to feel comfortable with us, to build a relationship, and that we will be their number one advocates throughout the time and the course that we treat them. The most challenging aspects of my practice, I think, has been somewhat of a moving target. When I first started practicing cardiology, it was about mastering the technique in the cath lab, and that was my main focus. But at present, it looks like the target has moved more so towards, once I get the patient out of the cath lab, I feel I'm obligated to keep them out of the cath lab, and I've much more concentrated on the aspects of prevention. My philosophy for patient care have to be broken up, I think, into two aspects. One is, I believe, taking care of the acute situation or crisis efficiently with the best technology and all the knowledge that we possess. The other aspect is, on a chronic basis, building up a patient relationship so that as time evolves, I believe that it's very important that we communicate, and that makes decisions in the future much easier to take. I've been here in Jackson training since 1983. And I did my internal medicine here at UMC, followed actually by a pulmonary fellowship, which I completed, and merged into cardiology. So I did my cardiology training here, and later on went and did my interventional fellowship at the VA hospital, at the Baylor VA hospital in Houston. The minute I rotated through cardiology, it was like, I think, knowing that that's the girl that you're going to marry. I could see myself practicing cardiology the rest of my life. And one of the main reasons is you could be an electrician one day and the next day be an ultrasonographer. The next day, or on the same day, different times, you could be in the cath lab. And I knew I was never going to get bored. It was a thriving field when I joined it, and it still is. And I don't think I've in any way made any mistake in picking the field.